Hi, I'm Dr. Ron Letterman. I'm an orthopedic surgeon here in Southeast Michigan. I have had the privilege of taking care of this gentleman, Mr. Ven Johnson, who is a tremendous attorney and a tremendous athlete, scholarship tennis player in college. And I had the privilege of taking care of him for his knees and Achilles tendon tear. And it doesn't surprise me how well you're doing, but we thought it was significant enough where it was worth telling your story.
Thank you, doctor. Thanks for having me. Appreciate you. How are you?
Great, thank you.
Well, I guess really starts out probably playing way too much tennis and basketball as a kid because the wear and tear caught up to me about 10 years ago. And I was, at the time, doing a lot of course, I'm a trial lawyer, so I do a lot of trials. And I started to notice that my knees were painful. And as time marched on, because I continued to play tennis, I played tennis competitively since age 7. Played in college and then ever since for fun, but still played competitively. It was much more difficult to the point where when I came to see you a few years ago now, I know I tore cartilage in one of my knees and the other one, even though I didn't tear cartilage, felt just as bad. And I was having 24/7 knee pain, 365 to the point, as you know, where I was waking up multiple times at night. And I'm not a painkiller guy, so I don't do the pills and all that stuff. I wasn't even doing Advil at the time, Doc. Remember that?
Well, that's impressive. And I'll tell you, you've got a high pain threshold, and you're a tough guy because I once watched you walk up some stairs and you were hardly able to make it, but you didn't complain. And when I inquired about it, you said, yeah, it's gotten pretty bad, which is what led to our most recent round of treatment.
Right. He kept talking about stem cells, and I'd done a little reading on it. Obviously, I'm not an orthopedic surgeon, but because of what I do, a number of my clients suffer from all sorts of trauma, including knees and lower extremity, lower leg stuff. And I've seen the stem cell stuff, and it's experimental, and so I was hesitant. I know you suggested a couple times to go after the knees, and I was hesitant, so we didn't go there until, dun, 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 the Achilles tendon.
Well, it may very well have been connected because, as you know, it's all one kinetic chain.
Right.
And if your knees are as bad as they were, then you're throwing everything off.
Right.
And we actually ended up getting an MRI of your Achilles tendon, which showed a 50% tear.
Right.
Historically, and we even talked about this, before 2, 3, 4 years ago when at Letterman Kordowitz Orthopedics, we started doing a lot of regenerative stem cell treatments, I would have said to you, either live with it, wait for it to completely rupture, or we go in there and reconstruct it. And the reconstruction, or if you tore it and had to get it repaired, that's a 18-month recovery.
Right.
And you're not someone that takes being held down lightly.
Well, I remember Isaiah Thomas, doctor, right? When he was playing for the Pistons, a lot of people, younger folks may not remember, but career-ending injury for older guys, and he was Dominique Wilkins, absolutely right. He was a great player for the Atlanta Hawks. Same thing, and a number of players over the course of time. Kevin Durant right now is going through the same thing, so it'll be interesting now that we have advancements in the orthopedic surgery, see where he ends up after the fact. But for older folks, yeah, it's a common injury, and I was devastated in the sense that when I showed you my ankle down here, it was probably about that wide. It was painful, but it didn't stop me from, I kept playing for a while, which I know is stupid. I shouldn't have told you that, but I did.
But the exam it was significant.
Right.
You had it was a significant prominence, a painful tender prominence, which was the layer upon layer of scar tissue as your body was trying to heal this repair.
Or a big bump, as we say.
We say a big bump, the size of probably 2 large walnuts. It was pretty significant.
Yep.
So we decided, after giving it a lot of thought, that you would be a good candidate for this regenerative stem cell treatment.
Right.
And what that involves is different for the Achilles, which is soft tissue, than what our stem cell treatment has been for arthritic joints.
Right.
So we briefly talked about some of the arthritis in your knee. You can inject it right in our office, no big deal. And 95, 97% of our patients are coming back saying, oh my gosh, my arthritic pain is gone. I'd say half the time we are doing the minimally invasive arthroscopic surgery to clean out the loose cartilage in a knee or a shoulder or a hip or the ankle before we do the stem cell. And in your case, we kind of did a whole trifecta. We took you to the operating room, not to do the surgery on the Achilles, but injecting into the Achilles is not a very comfortable thing. We don't do that in the office. So we were able to give you some happy juice with an anesthesiologist.
It's because I'm a big baby. I admit it. I'm not going to go. It's like, remember I asked you, it's like, you're going to put the needle where? In the tear of my, and it sounded horrible. So I said, no. We'll go to that little operative suite.
We did.
We did.
We did. And so we gave you a little anesthesia, and right in that tender, painful area, the size of the large bump, I was able to put, in your case, I think, a double stem cell injection all around and into the tendon. Now, you're right, this is all considered experimental.
And I think that's really important here because you and I talked about it. I asked you, tell me about it. Not as experimental, but you didn't even know of anybody else anywhere that had tried putting stem cells in a torn Achilles, right? So come on, don't be so like humble. That was amazing. How did you think of that?
Well, we know that PRP, plasma-rich protein, which is when you draw blood from yourself, we spin it down and we end up with this plasma-rich protein that we take out of your own blood. That has some regenerative properties. And we've been doing that for years. As a matter of fact, I think 12 years ago, Tom Brady did that on his Achilles.
I heard of him.
Yeah, he's doing pretty good down in Tampa Bay. So the stem cell is much more effective in helping regenerate tissue.
Why?
Well, what we're using is the donated tissue from a human umbilical cord and or the amniotic membrane tissue after a healthy newborn delivery. So the mother donates this tissue. There's a few very quality companies that will take the tissue, they process it, it goes through a very strict process to eliminate any chance of transmitting infection, virus, and we have not had a side effect from a stem cell injection. We have not had a reaction to it. We've had no rejection. So in your case, we're thinking, well, we've got two knees that are really hobbling you, and we have this Achilles tendon. So we ended up scoping one of your knees, I believe, not at this time of the...
A year or so ago, you cleaned up one of my knees.
And it did well, but then the arthritis caught up. So on this day in the operating room, we took the stem cell and put it into and around the Achilles tendon, and we put it in both your knees. We figure you're already asleep, why not? But you
That's the trifecta.
That was the trifecta. But you have to understand how remarkable your MRI was. The MRI, anybody, a layperson can look at the images and see that 50% of your tendon was torn. There was abnormal signal, and look, you're a big guy, you're doing a lot of things, you're on the tennis court. Maybe you weren't because it didn't allow you to at the end there, but it was a complete rupture waiting to happen.
Right.
How was the experience at our surgery center? And
your surgery center is ridiculous, as I've told you. Best service, but I have never had more direct conversation, with my surgeon, but even more so, no offense, with an anesthesiologist, because no offense, but they're in and they're out, and then the CRNAs, the nurses come in and take over. But no, it had an excellent, and everybody was so polite, so wonderful. I was in and out, and I think, half hour, 45 minutes after the procedure, I'm in the car, and Mal's taking me home, and we're all good. But it was amazing, like always.